So if you see the normal breath sounds, so these are traditionally organized into the categories based on their intensity and also pitch and location and also inspiratory to the expiratory ratio. So these breath sounds are created by the turbulent airflow. So this is going to be depends on categorized into, these are the four categories are there: tracheal breath sounds, vesicular breath sounds, and also bronchovesicular breath sounds. So these breath sounds depends upon the intensity and also depends upon the location. So and also inspiratory expiratory ratio. So if you see in the inspiration, the air moves into progressively the smaller airways. If you take the breath in, the breath into the bronchioles, and also then is going to the small airways. So because of the smaller airways with the alveoli as it's the final locations. So where the oxygen is going to be, the gas exchange takes place. So that is called as the alveoli. So it's going to reach the alveoli. So as the air hits the walls of the airways, the turbulence is created, then it produces the sound. So the normal lung sounds, if you take the breath in, so from the trachea to is going to the lung, so through the primary bronchus, secondary bronchus, and tertiary bronchus. From the tertiary bronchus is going to into the bronchioles. From the bronchioles is going to reach the final destination will be in the alveoli. So in the alveoli, the gases exchange takes place. That means carbon dioxide is converted into oxygen. That oxygen is going to be supplied to and transferred into the heart. So through the pulmonary vein, so there is going to be gas exchange takes place. So how the air enter into the bronchi, so the primary bronchus, then it reached to the alveoli. So because of the hitting the walls, so it gives the turbulence. So the turbulence is nothing but is called as the sound. It produces the sounds. But in the expirations, the air is moving to the opposite direction. So that means that the carbon dioxide is the gas is going to be come out through there's the reverse flow through the expirations. So it's towards is a progressively larger airways. So that means the carbon dioxide starts from the alveoli. So from there is going to enter into the larger walls. So from to the tertiary bronchioles and also secondary bronchioles and primary. So it comes to the larger airways. So in the larger airways, what will happen? The turbulence is going to be created, but there is going to be the less. Because of in the inspiration is going to be the more turbulence. Here is going to be the less turbulence is created because of the small to the larger like a bronchioles it comes. So because of these expiratory sounds are these are going to be normal expiratory breath sounds are the quieter than the inspiratory breath sounds. Because of these expiratory sounds are going to be the quiet because of turbulence is less. Inspiratory sounds are going to be turbulence is more, so the sound is going to be a bit like a louder. So what are the bronchial and also what is the tracheal breath sounds? So these tracheal breath sounds, so if we are going to see the four sounds, this is the tracheal and also bronchial sounds and also bronchovesicular and vesicular sounds. So these tracheal breath sounds are very loud and relatively high pitched. So these are going to be high pitched. So the inspiratory and expiratory sounds are more or less equal in length. So these are going to be heard in the trachea, and also we can see here. So these are going to heard in the surrounding the trachea. But these inspiratory during the inspiration and expirations are more or less equal in length. So they are going to be, so sometimes it's going to be more or sometimes going to be less. But in the equal the sounds are going to be appearing. So they can be heard over the trachea, which is not routinely auscultated. So we are going to heard this tracheal. So these are so this is going to heard at the tracheal levels. So because of this is not a normally routinely auscultated. So in the abdominal conditions also sometimes may hear, but most commonly we are going to hear the bronchovesicular, vesicular. Most of the lung is going to be heard about the vesicular and also bronchovesicular. So this is very rarely we can heard. So coming to the vesicular breath sounds. So you can see the vesicular breath sounds. So most of the breath sounds, also bronchials are going to be heard over the bronchial region. So these are the bronchial sounds. And also if you come to the vesicular, most of the lungs is going to be heard about the vesicular sounds. And bronchial vesicular sounds are going to be heard in the particular areas. So this one is going to be. So about the vesicular breath sounds. So these vesicular breath sounds is the major breath sounds and is heard almost over the lungs. So most of the lungs we are going to hear this vesicular breath sounds. So these are going to be the soft and low pitched. And inspiratory sounds are the longer than the expiratory sounds. So inspiratory sounds are going to be longer so than the expiratory sounds. So what, because of is going to be prolonged time and duration also going to be prolonged. So these vesicular breath sounds may be harsh, slightly longer if there is a rapid deep ventilations. So if, for example, if anybody work out and exercise, so these sounds are going to be is a longer and also is going to be is the harsher than the remaining breath sounds. So it's most commonly heard after the post exercise. If any exercise or maybe any workout, so these sounds are going to be heard the more frequent than the other times. And also in children who have the thinner chest wall, if anybody having the thinner chest wall, so these sounds also going to be harsh and also we are going to heard a bit louder. As well as the vesicular breath sounds may be softer if the patient is frail or the patient is weak or in the elderly or obese or in case of the very muscular conditions. So we are going to heard these sounds are going to be is going to be is a little bit softer and also in case of the patient is weak. So that's the reasons. So we have to understand that while the differential diagnosis, we can think if the sounds are not like often, or maybe we can think about is there any chest wall deformity, or if anybody having a thin chest wall, or in case of if the person is weak or obese, so we can easily understand, depends upon the breath sounds. So coming to the next one is the bronchial breath sounds. This bronchial breath sounds is a very loud, high pitched, and also sound close to the stethoscope. So these sounds are going to be is a little bit of louder. So and also is going to be the long and also high pitched. We can hear the high pitched. So there is a gap between the inspiratory and expiratory phase of the respirations. So this we have to understand if any gap that is during the inspiration, breathing time. So and also breathe out time. Is there any gap? So the sound is going to hurt some gap. So that sounds are going called the bronchial or breath sounds. And also if there is a sounds are heard anywhere other than the manubrium, it usually indication of the area of the consolidation exists. So the consolidation is nothing but is any the spaces, air spaces filled with normally is filled with like a air. So is if any fluid or any is there any abnormality also sometimes we are going to heard this bronchial sounds. So you can see here most of the time we are going to hear this bronchial sounds in the manubrium sterni. So in the sternum we are going to hear. If other than the sternum, so it indicates the consolidation. Consolidation means already having any fluid accumulation or any abnormal air also. So we can think about the bronchial breath sounds. So and also next one is the bronchovesicular breath sounds. So these bronchovesicular breath sounds are sounds of the intermediate intensity and also high pitch. So the pitch also going to be intermediate and also the pitch also going to be intermediate compared to the bronchial sounds. So here the inspiratory and expiratory sounds are in equal length. So this inspiratory and also expiratory both are going to be equal in length. So while assessing, so if it is the longer or if it is the shorter means, so we can easily differentially diagnose. So which one is the vesicular sound or which is the bronchial sound, which one is the tracheal sound. So compared to this one is it depends upon the inspiratory and expiratory sound. Is there any gap is there or is there any equal like a durations? So depends on this one we are going to differentiate the different type of the lung sounds. So they are best heard in the first and second intercostal space. So if you see here, so this is the first and second intercostal space in the anterior chest wall, but in the posterior chest wall, we are going to hear the in between the scapula. So that is here we are going to hear the bronchovesicular sounds. So we can hear if in somewhere, if this one is intensity and also if it is louder, so it means it's not the bronchovesicular. So with the bronchial sounds, when these sounds are heard anywhere other than the main stem of the bronchi, it indicates the area of the consolidation. Normally, just now we discussed is going to heard in the first and second intercostal space in the anterior chest wall and also in between the scapula. So it is the normal. So if it is other than these places, so it indicates the lung consolidation. So why we have to know? So we have to know where we are going to heard these sounds normally. So other than these sounds, other than the normal locations, so it indicating the consolidation or maybe is a fluid accumulation or maybe air or also it may give the sound will be different. So this is going to be is called the other sounds or advanced sounds also we can consider.